So now we switch gears to move to next section of the test that focuses on digestive enzymes and absorption markers. Obviously, proper digestion is fundamental. So we do look at the pancreas. So we assess pancreatic elastase. That's a marker of pancreatic enzyme output. Low levels may suggest exocrine pancreatic insufficiency, meaning that your pancreas is not working at its capacity, or in other words, you have a sluggish pancreas. And that is different from the endocrine function of the pancreas that is responsible for insulin production. Exocrine insufficiency is common in chronic GI inflammation, in SIBO, and actually we see that just with aging. So also, we assess fat absorption that's related to pancreas. What is that? To put it simply, if your stool is greasy and it floats, then you may have a problem with fat absorption. And it's evaluated using a marker called Steatocrit. So when Steatocrit is elevated, it signals issues with the bile acid absorption or with pancreatic dysfunction. Moving ahead, we also analyze markers like occult blood, which may indicate GI bleeding and warrant further investigation. And in that case, we always refer the patient for colonoscopy because of concerns of colon cancer with occult blood. The next section in the gut test is inflammation and immune function assessment. Inflammation in the gut doesn't always feel like pain, so it doesn't have to be necessarily painful. And here we do measure several markers. We measure calprotectin, a special protein that reflects active inflammation in the colon. Calprotectin is very helpful in distinguishing IBS, that is irritable bowel syndrome, from IBD, that is an inflammatory bowel disease, and that includes ulcerative colitis and Crohn's disease. And unfortunately, high calprotectin may also be seen in colon cancer. So again, if somebody has a high calprotectin, then we do refer this patient for colonoscopy. We also examine secretory IgA, that is the primary immunoglobulin lining the gut mucosa. So this tells us how the immune system is responding to irritants, whether it's hyperactive, suppressed, or imbalanced. So finally, what are the whole body implications of the gut test? So many patients are surprised to learn that gut dysfunction can manifest as fatigue and anxiety, skin problems, joint pain, and hormonal imbalances. So the gut test, which is the stool test, becomes a foundational diagnostic tool helping us map the underlying biological disruptions. So you did the gut test and sat with your functional medicine provider who went over the test. So now, what is the next step? So